Hello everyone, today we are going to talk about revision rhinoplasty. When a prior nasal surgery does not produce the expected effects or cause breathing issues, a specialist operation called revision rhinoplasty is utilized to improve the look of the nose and rectify compressed nasal functions. The necessity of a second operation may be extremely frustrating, and patients frequently become disillusioned as a result. For this reason, revision rhinoplasty surgery requires a skilled facial plastic surgeon with training in advance. Rhinoplasty techniques to successfully navigate the complexity of the procedure. During this video, we will explain to you everything related to this procedure, when to resort to it, and the expected results after this procedure. Our role today extends on most of our questions regarding revision rhinoplasty. Today we have Dr. Rhee, who is a leading doctor at Grand Plastic Surgery. He is going to discuss with us everything about revision rhinoplasty from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so that next time you'll be updated with our new releases. Hello, Dr. Rhee, how are you?
Good, how are you?
So, can you introduce yourself to our audience?
Hello, I am Doctor Rhee, a plastic surgeon at Grand Plastic Surgery Korea. I am the head of plastic surgery at Grand.
So for our first question for rhinoplasty, what is the difference between normal rhinoplasty and revision rhinoplasty?
As for normal nose jobs, we place prosthetics inside a clean nose without any materials being present. In revision rhinoplasty, we are essentially redoing a prior job, which requires taking out the prior prosthetics and performing the surgery again.
So how often do you receive cases of unsuccessful rhinoplasty that other doctors did?
Lately, it seems that there are more revision rhinoplasty than original rhinoplasty clients. There are more rhinoplasty clients than before. Also, before it was popular to have exaggerated nose jobs, but lately people prefer the natural-looking nose jobs. Since it is harder to do revision than the original, many come to us to redo their nose jobs.
So what causes the clients to have revision rhinoplasty?
Dissatisfaction with their nose shape is the most common. Long ago, the technology to raise the nose point was not that good. So, most preferred to raise their nose bridge. Since the nose tips were difficult to raise, there were many not so natural looking noses. So, lately the most common revision is to make the nose bridge look natural while raising the nose tip. Second, there are patients with crooked noses. So, patients with crooked noses or infections which require the removal of old prosthetics. Broadly speaking, these are the top 3 reasons for revision surgery.
So what kind of person is not suitable for a revision rhinoplasty?
There are limits as to what we can accomplish through surgery. So if a patient already raised her nose as much as she can, and she wants another just because she is unsatisfied, we cannot recommend it at such a point as the results can potentially be suboptimal. In such cases, we take a CT scan and look inside to determine if there is room for expansion, and all is okay structurally. The worst situation is when the results are fine, but the patient is adamant on trying to improve upon even more. Then it is not advisable to proceed.
So today we learned many things about revision rhinoplasty, and the doctor explained in details everything related to this corrective surgery. Thank you for joining us today at CloudHospital TV. If you have any questions or comments, please leave them below and respond to you as soon as we can.